Lovely.
Okay, so we're here, Boardroom Spotlight. This game is called. So let's go. I think what we need to do is pick up one of these questions from this bowl. Let's go.
See what they are? Yeah. Do you want to go first?
Yeah, you go first.
Pick the questions.
All right,
See
try and
what
get the
they
bottom
have
of the list.
prepared for us. So,
If it's not too much of a hard question, we'll see.
first question: what's your approach to teaming up with public bodies and community organisations?
What a question to start. My approach to teaming up with public bodies and public organisations.
Community organisations.
Well, my approach is to make contact with them, to see how best we can work together using our strengths in mega resources and mega care, such as being expertly skilled at care and this is a terrible question, man. My approach.
To be honest, if I can jump in, what I would say.
My approach to public organisations.
I would say my approach would be mutual benefit. So like, where we can help the community bodies and public organisations, they can also help us. We both have the same goal when we're caring for our service users and their patients and clients. We all want for them to achieve the best in care that they can. So I generally feel as long as we can provide valuable offering that's either free or cost effective or benefits them, then everyone's happy. And I think that's generally my approach would be: what services can we provide?
Yeah, okay.
How can we benefit them whereby they don't need to then fork out too much outlay as being obviously charitable organisations, but also for ourselves it's sustainable.
So rather than our approach, I guess what we have done, if you look at one of the services like Urgent Support Link, we're working with third sector, which is these respite organisations like Carers in Bedfordshire, to provide a service that meets the needs of unpaid carers. Now, in that, that makes sense. We would obviously be doing what we can using our tech-enabled software that we've developed, Urgent Support Link, the app, to try and find a way to enable better respite for unpaid carers and also free resources. So, putting together all the different resources that's online that you can see already there, but putting it into one place, making it easier for unpaid carers to access the resources they need, and training as well, second opinions. That's one of the things that we provide quite well. But that's just one third sector organisation or public body. There are others that we've linked with, like Age UK, for example, right? Utilising their cognitive stimulation services and their groups to support what we're doing in mega care and enable that different things for our service users to do, and to improve their well-being.
Yeah, and I think that's generally it. Yeah, where we can formulate things that will, end of the day, benefit them, whereby it would
mutually
probably cost a lot of money
well
and time to be able to bring out resources like Urgent Support Link. But if we can bring it out and then roll it out and give it as a free resource for them to utilise, then as well we can obviously benefit from that through the client sourcing generally. Yeah. Okay. Well, it formulated to a better question at the end.
Yeah.
I think we should
Our
go
approach,
again.
I'll ask the next one. Let's find one that's a bit easier. Let's see. Right. How do you track your impact and share the results of the great work we're doing? How do we track the impact and share the results of the work we're doing?
Well, track it. We track it in multiple ways. So we ask for feedback in every step of the way, which is one thing that we hugely rely on. We survey our service users on a regular basis. We have to feedback every single time we see them. They can send in anonymous feedback. We send out feedback surveys, and we love good reviews. Our reviews currently now on Google Home Care, so they generally look really, really good. And we love to share it. That's what our marketing team is here for. Put it out on our websites, Instagram, social medias, and yeah, I mean, it's good for us to hear what we're doing is right, but it's also good for us to be able to publicise
Yeah.
in the same manner.
Yeah, our commissioners require from us, well, some of our commissioners anyway, particularly the ones in Bedfordshire and Gloucestershire, require some level of reporting anyway, and they receive that. So we have, actually, we have a data analyst that records outcomes, right? And outcomes is the big thing now. Outcomes focused care, personalised care, and we track that through our analyst and through all that, all the notes that carers write after their care visits, the different outcomes, and that served purpose in enhancing our quality, seeing where our service users have improved, and seeing what we can do even better. So
yeah, and I think it goes hand in hand with how much we do with the reablement, and because away from hearing what you're doing, if you can see what you're doing, if someone has come in with any injury, ailment, struggling to walk, needs to be rehabilitated, and we can get them to that point of rehabilitation far before their clinicians have said that they will be able to be able, they won't be walking properly for X amount of months or X amount of weeks, and we can get them there in 2-3 weeks. We can get them to start showering and washing themselves and cooking for themselves and caring for themselves far quicker than their general expectation. I think for us enough, that is a visual representation of what we're doing.
I think we've gone a long way, and I know that we've done a huge push on ensuring that everything is on that one system, Careline Live, that we obviously adopted years ago, right? So as much information we can get on there, the better we can track and ensure that the outcomes being achieved, but also quality is continuously improved, right? Because it's all there on that one place. So each service user has their own records, has everything on there, from their service plan, their care plans, to the notes that's been taken on a regular basis. And these things are analysed by our coordinators, and we can continue to advance their health and well-being by that. So yeah.
And we do have a newsletter on our website whereby you'll see a lot of our successes. Released regularly enough.
Yeah. So I think we can do the next question now.
Okay.
What have you got for me?
Pick a piece of paper. Let's see. What's Megacare's big why? What drives your mission in the world of social care?
Okay. Well, mission statement.
And this one's a better.
Mission statement. I'm going to start off with to provide family-like care across the areas that we're in, right? So that family orientatedness, that starts from us being brothers, and our mother Margaret being CEO, and that obviously flows down by the way we treat our carers, our staff, and then that then translates down to how they treat the service users as well. So having that family approach, supporting where needed, being open to listening to different things, their ideas, right? Staff's ideas and initiatives, and taking those forward at every level. That's in my mind where it all starts, right? Our mission statement.
I'd say for myself, not to piggyback off our mother CEO's main why. When I was younger, she was working in nursing home, Claremont nursing home. I actually had a little stint there myself, mainly in the kitchen.
His first job, wasn't it?
It was my first job, 16 years old, working there after school. So when mother was going there, she was caring for the people in the nursing home, and from her experience, the way people were moving in relation to their reablement and their independence was actually negatively affecting them by being in the nursing home. So she wanted to find a way and develop a service whereby you can keep those individuals at home for the longest period of time. There are always the need for a care home and a nursing home. You get to a point whereby even the wider public services may not be cost effective outside of a nursing institution. However, I believe it was just happening far too early, happening in a sense of trying to cut the costs and not want to give them independent care at home. But then with reablement and with adequate care and adequate monitoring, you should then be able to reduce how much support they need at home, making it cost effective for them to stay at home. So I guess my main why would be the service users, right? It's a better position for them. All theories and research and analysis has shown that they have better outcomes at home where they're comfortable, have their family around, people they love can pop in and stay with them, and they feel a lot more fluid. So I feel like
and they can better
why is what we're doing
maintain their
for
independence.
them. Yeah, keeping people independent for longer, keep them healthy for longer, and generally happier for far longer.
Yeah, yeah. They can better maintain their independence at home, and I completely, obviously the mission, the vision statement is you know, why we do what we do, right? But no, you're absolutely right. You know, it is about the service users, and it is about the service users staying in their homes for longer, because they're, as you say, in their own environment, they're able to, you know, be more independent at home. You know, not deteriorate quicker, like they would if they're in a care home or if they're in a different facility. So, yeah, we're definitely all about domiciliary care.
Yes.
Yeah.
Yeah. Moving into supported living, but we still going to fixate
but
on
supported
smaller
living.
units. Still living like they're a small family together in a household, to mimic as much as possible them being in their own home.
We've got domiciliary care, we've got supported living, we've got extra care. All these different routes are more independent than care homes. Care homes for people are, you know, when they have deteriorated enough to not be able to have care at home anymore, or in these other facilities, or way more independent. So yeah, our big why is the care and compassion that our mother started off, and obviously translated to ourselves, has for service users and providing quality care at home.
Yeah.
Yeah. Yeah? All right.
I agree.
Is it me?
It is you.
Right, let's go. Hopefully this is head of marketing providing these questions. Is interesting. Interesting questions. Right. What inspired the launch of Reablement Services back in 2020, and how has it made a difference for the people we support?
I know you're itching to answer this one yourself. However, I will interject initially. So yes, Reablement Services generally started through COVID, through people ending up in hospital and them needing to discharge people out of hospital as quick as possible, and it being the breeding round for COVID.
If you remember that time though, panic, huge amounts of panic in the hospitals, open for everywhere. It was an unbelievable time. Whereas you know, we were ready. We were ready to, you know, to support the system.
Yeah, we formulated our battle plan. And
yes, the battle plan, if you remember that.
The battle
sent
plan.
out to constructed and sent out to every staff member. We are in control of this situation.
Mapped out every occurrence that could possibly happen, up until the point whereby we only have about 20% of our workforce.
Yeah.
We never got to the point of being at that stage. However, being ready and prepared for it is how got us into Reablement when we did.
Yeah, but if I remember, because at the time I was chairing the home care providers in Bedfordshire through the Beds Care Group, and a lot of places were struggling. Staff were going off because of COVID, right, and because of the scare. And a lot of service users were panicking as well. You know, I don't want to get COVID, etc., etc. So it was such a, you know, an interesting panic time. But there was always order in that kind of, you know, chaotic time. And I believe we brought something to the table. So what did we bring to the table? We brought rapid response. We came with a solution at the time. And I remember speaking to some of the service directors in ELFT, which is the East London Foundation Trust, and they wanted some support. They needed some support with providing fast, responsive, efficient care as soon as possible, without any delays, so they can clear out the hospital, because the hospital at the time, both Luton, Dunstable and the Bedford hospitals were bedlocked. They didn't have enough capacity, so they needed people that were fit to discharge immediately through the discharge to assess scheme to be, you know, flow out as fast as possible, and to provide that interim care of 4 to 6 weeks we needed to provide, and we were ready to do that. So when the call came, we responded. We were able to provide rapid response services, that was the birth of our, we did have reablement before that, and I know in Northamptonshire we'd always been re-enabling. But in terms of a specific service, the rapid response service, that started around that 2020, I think it was October, with rapid response. And essentially this is when they are fit to discharge, they come out of hospital onto our service, our rapid response service care assistants take them on, they understand what their outcomes are and where they need to go from that point where they are, understand where they were before their baseline capabilities and try to get them back to that through the assessment and care plan, etc. And then after 6 weeks, they should be able to be offloaded onto another long-term provider, whether it's us on our main care program or another provider. But we kind of provided that very important middle service to support the hospital, to support the other public bodies that did not have capacity at the time.
And at the time, to be honest, we were very, very lucky with the pool of carers that we had.
Yeah.
Our carers were fantastic. So, some of them are hearing this. Thank you to all of you who were there at the time and those that are there now.
Yeah.
We did give them assurance, which I believe helped the situation, that regardless of what the government was to do and what to say about employment and say about having the COVID jabs and not being able to employ carers, we would still employ them and we would still pay them. We would stick by them. Yeah. And I feel like because of that, and hope for other reasons as well, they stuck by us through the whole time. And our carers were happy to go in without the fear of COVID and with all their PPE, and were happy to know that their finances won't be affected for any reasons. And if the government was to change their mandate, as they were doing probably every week at that point, we would stick with them.
Yeah, and if you remember, we were right on the cusp, home care. Yeah. Care homes had just had the mandate for the vaccine jab. And we're not speaking anything against the vaccine jab, because they were here or there for us, whether it works, whether it doesn't work, I don't know. That's not what we're discussing. But what we're discussing is the mandate, the government's, authoritarian, you must get this jab, otherwise you can't work in care. And it started off with care homes, and there are a lot of carers left care homes at the time.
And they haven't came back, sadly.
Absolutely. But then it was just about, and I remember some of our carers, talking to me, saying, are we going to be mandated to take this jab? And I was like, well, listen, we'll stick by you. We will stick with you, right? And just at the cusp of the mandate coming through,
like a week
they
before.
rescinded it. Yeah. They rescinded it. And us being loyal to our carers and sticking by them, it all paid off. Now they could work, they could work even harder for us because loyalty is a two-way thing. We earned their respect, we stuck by them, they continue to work at tremendous pace within this very high pressure rapid response reablement service. And now another thing you mentioned about the carers and adapting. Our carers had to adapt to the new way of working. Yes. We're talking, it started off in Bedfordshire. I know we rolled out a rapid response to West Northampton area as well, but it started off in Bedford. They were used to going to their own service users every single day, every week, nice structured, carefully designed rotas. But then, of course, all that was thrown out because they had to get to wherever they need to get to. It could be, as far reaches as the parts of Milton Keynes as near to Bedfordshire, all the way to near Northamptonshire, and some even near Oxfordshire. They had to cover a huge area, and had to travel much more than they ever had to travel before. So this was a change of culture. They had to adapt to the circumstances, and they did amazingly well.
They did fantastically well. We would assess and get them out within 2 hours, and they'll see a new person on their road to have to read through the care plan, the assessments, all very quickly to ensure that they can still provide safe care. And they did a wonderful job. They are now, I would say, some of the most, if not the most skilled carers we would have in the country, because it doesn't matter who they were going to see.
Yeah, they had to see everybody.
Had to have the skill set to be able to look after them, care for them, and reable them.
Yeah,
and also the patience to deal with anyone and everyone.
Yeah, I mean, training went up, so they've taken on a whole bunch of new skills as well, because they had to deal with, as you say, anything and everything. Whoever comes out of the hospital, we had to take them on, we had to care for them, we had to re-enable them. And I forgot to mention, actually, part of what we did as well is the physio, is that physio support. Once the physio sees them and gets out to them in the first few weeks, we then continue their physio, re-enablement as well, right? So that time was very interesting.
It was an interesting time.
That was the main birth, the big birth of our reablement, and now we continue with some of the most advanced reablement schemes across the country, because we have dealt with so much and we have enabled so many people.
And we can roll out service in a couple of weeks, which is even better.
Absolutely. Yeah. Okay, that was a question.
An interesting one.
Yeah.
Yeah.
Took us down the road of history.
Little rabbit hole.
Is it you or me now?
It's you, I believe.
Is it? Is it me?
Yeah,
Yeah?
I believe it is.
Someone's heckling from the sedentary position. It's not on camera, but it's okay. Right. How do you keep everything safe, sound, and fully compliant? This is right up your street, Winner. How do you keep everything safe, sound, and fully compliant? You're Mr. Operational Compliance, so let's see how you answer this one.
I mean, generally is with our monitoring. I had been pushing for years, obviously many years ago, to get us all online, get us all on the cloud so we can be responsive. And I feel like safety and compliance starts with responsivity, being able to be there at the point of change. So moving everything onto the online services, and Careline Live, to be honest, improving their software continuously, enabling us to be able to go online with mark sheets, comment sheets, reviews, spot checks, documentation changes and audits, has allowed us to be responsive, which in tune allows us to be safe. Our training is always 100%. We have in-house trainers across all of our branches, a training room in all of our areas, and we consistently train to 100%. We don't accept the 80%, 85%, 100%. If you get anything wrong, we'll sit with the trainer and ensure they get to 100%.
Yeah.
Like, overall safety and monitoring for me is extremely important, and it's the thing that if you don't, that you can get away from you. As you're building and you're growing and you're taking on new service users, training new staff and trying to build up a service, you can almost forget about those things that are so pivotal, which is, are they consistently doing what they should be doing correctly? Without all the complaints, without the things, can you see it and monitor it yourself? And now, with the team that we have of multiple coordinators and assessors and data analysts in our branches, they can see any form of shortfall, because it's then they act quickly.
It's past just thinking about inspections, right? Keeping things safe and compliant. It's past just thinking about inspections. And last year, we must have had at least 6 inspections. CQC came out, multiple PAMS assessments. We had a lot of inspections, and we, of course, we did well in all of them. But it's past just that. It's the care and concern for our service users and our staff, ensuring that things are done well and are compliant. But we've also got more than what you just said. We've also got other things like, on medication. What do we call them? Because I know they deal with medication, right? But what do we call them? Are they medication administrators? Are they medication team leaders? But they do a tremendous job in identifying, fully identifying the medication in each service user, liaising directly with the pharmacies, etc., and ensuring that things are always stocked up. They do all the mark sheet competencies and stuff. What do we call them? Because I know they're called team leader and they're called medication something. We just have a position.
Almost
without
field compliance specialist.
Oh, there you go. We can go with that.
Sounds quite good. But generally, yes, they go and ensure that everything is accurate. Medication, we understand when people go in and out of hospitals sometimes, and when people go in for checks, so they get their medication changed, and there can always be the gap and lapse in time before the information moves and travels to the right place to ensure that our carers have the right information. And these individuals specifically stop that from happening, ensure that there's no delay.
Nothing missing.
We'll go straight, obviously we have the GP Connect on Careline Live as well, which is beautiful because we can directly see their prescription that comes in from the GP or from the hospitals, and then we can update it in that regard as well. If they know that they've had any spell, any fall, any issue, they'll go and review, change the risk assessments, change the support plan, just to ensure that we are always having the accurate information, but always up to date with their care and support plan.
So field compliance specialist.
Field compliance specialist we have.
We should propose that to our associate directors and be like, right, this is what we call them moving forward.
We have quality compliance specialists as well that are there just then obviously assisting the care coordinators and things, but just ensuring that all the compliance will go out to do it, the reviews and the supervisions and the spot checks, things that are now rolling out every month for almost all of these things. We keep up to date to it just mainly because we have a really good and strong team. We try very hard not to scrimp on that. The support team that we do provide.
So from conversations and meetings I've had, obviously the external inspections that we have regularly, and as I said, we had 6 only last year, are, it can, get your heart pumping because you want things to be 100%, and people do a superb job, as well as us, to ensure that we always are compliant. But do you know who they fear the most? Do you know who they fear the most in terms of an audit, internal inspection?
Mother.
When Mum comes out to inspect, or when she mentions she's coming out to inspect, that puts more fear and trepidation, unfortunately, into each and every one of our management, because she does arguably even more in terms of scrutinising the finer details of everything.
She sees what we don't see, 100%.
So you can't get anything past her.
And her clinical mind, of obviously 35 years experience now.
Advanced nurse practitioner, right? So she knows exactly what she's looking for, as well as being in care and around care for a very, very long time, hospitals and all sorts. So we've got multiple ways of ensuring that we are safe and compliant.
And we are, which is shows you that it's working.
Absolutely.
Okay.
It's you. Boardroom spotlight. It's getting interesting.
Okay.
What have you got for me?
Are there any clever tools or innovations you're using to improve your services? Are there any
clever tools and innovations?
Wow,
what a question.
To improve your services.
Okay. Well, I mentioned Careline Live, right? And you've spoken about. I think I spoke about this actually. Getting everything into one system. That's obviously the main tool that we use, and it does improve our services by ensuring that we are using that one. Right? We've had a spell of having multiple, and we still do have care docs, right? Because care docs provides that fuller support plan, care plan for our service users. But getting everything on the Careline Live, like our supervisions, our spot checks, our we can do data analysis on there, and everything else, everything in that one tool, can ensure it's the best quality.
Urgent support link.
Yeah, I was just about to say that. Thank you very much. I think a lot of what we're doing for innovation can go around urgent support link as well. I think when you're dealing with care, the bells and whistles are great. But really what's most important is that it's consistent, it's safe, it's effective. And you get the outcomes for the service users and the independents. And maintaining that consistently, I think you're already providing the best care that you can. There are further ways to assist and enhance the lives of the service user, but also the people that do care for them, being their family or the carers themselves. And that's where Urgent Support Link comes in place, and that's where parts of it will be going into phase 2 of Urgent Support Link, which is on teleproof and vital signs, be able to
vital
track
signs monitoring,
the direct well-being of the service user, see if they're malnourished, how they're sleeping, how their skin is, see if it can allude to any oncoming diseases or ailments that we can proactively work on before it needs to get to the point where they have to go into a hospital or they have to see a GP, which I think the innovation around preventative care is what we're doing more, and things in relation to helping people up from falls, and I know that's
that's all
major
part.
thing that we're trying to implement now.
That's through the emission avoidance.
Exactly, through the emission avoidance, and I think that's where the innovation in care stems from. Is whatever you can bring in that will keep people healthier for the longest period of time, and just stop people going into hospital. Because I know that at 6, 8 hour, 4 hour waiting period sometimes for when people have falls, and some falls are bad, of course. A lot of falls, if you can mold out the way to assess the reality of the fall, and if there's any issues from it, then yes, carers should be able to help the services off the floor and then get them to a better position and seated and already healing before they get any GP specialist or the
like clinical
people that come with the ambulances. Sorry,
No, but I'll just on that. It was a conference that we went to. I can't remember who went to it. I think it was me and you actually.
The Excel,
the chief. No, it wasn't. It was one of the really ultra clinical ones, which is superb. But we spoke to the chief executive of the ambulance service in Wales, I believe. I can't remember his name. But he spoke about the two key things that were, called out the ambulance more, right, the most, which was chest pain and falls. And the majority of the chest pain wasn't something that they needed to be called out for, that this could be offloaded to a care provider with the competency to do it, right, to go out there, but no one wants to touch it because it's chest pain. It could be all sorts of things. But actually, there could be some training that goes into this that enables providers like ourselves with the admission avoidance capacity to be able to respond to this, as well as falls. And falls, you just need some tech equipment to lift them up, to kind of support them up, etc.
There are the razor chairs. There's some brilliant equipment that are out there now. It's really assessment of damage and
risk
that you need. That is the main thing that you need to get round. And we have got a lovely individual actually who is the one who does moving and handling, train the trainer, and we're actually working with him to try and do some sessions with our carers to be able to assess from any of the injuries that comes from falls, to be able to say, okay, yes, we think it's safe to be able to use equipment to raise this individual up, and still wait for the paramedics to come out and further on, but then they'll at least be removed from the position of risk and discomfort that there was in initially, which is
So we've discussed, so that's within admission avoidance, right? So that's preventative care, that's all the vital signs stuff that we obviously do with that, and we discuss falls, etc. But innovation, to touch on this completely, yes, urgent support link, you touched on it. The very purpose of urgent support link is to provide that respite care for unpaid carers, right? They need respite. They need to be able to go to their doctor's appointments. They need to be able to go and see their friend, have rest. These are people that work, that do a lot, and they get it, completely unpaid, right? And this could be anybody. It could be us. Anyone who's caring for their loved one needs some sort of respite. We know how much we do in a day. We can't always be caring for that one individual, although they may want to. They need a route to respite, fast and easy and quick. And this is where Urgent Support Link comes in. You're able to just book a carer through the app. And by the way, the app was created by Stately Web, Stately Digital Solutions, which is a subsidiary company of Mega Group. And what an incredible thing that's brought in, that we're able to design and build an application, and the wraparound things as well, like the portals and the dashboards, etc., to kind of power this Urgent Support Link. And we've obviously got that in our own group, rather than having to externally contract that out. Well, obviously it's cheaper, but also we have full control of the design. Now, Urgent Support Link, as well as being able to book a carer, and whenever you need it through the app functionality, you can book a second opinion, an expert opinion by paid carers. So they will essentially press that function and be able to ask one of our carers to go out there and just to verify that what they are doing, the care that they are doing, is done correctly. They're doing it well. But as well as that, there's a bunch of training, a bunch of signposting to different resources and things across the areas that we're in as well. But if they can't use the app, they can also call us as well. There's a dedicated number, and they can go on our website, log in to there, so they don't have to have the app. But the app, of course, is a innovative, tech-enabled. It's got tech-enabled purposes. So yeah, there's a number of things we're doing,
Yeah, sounds all very innovative.
Yeah, it does.
Yeah.
Okay.
It's your turn, okay?
Yeah. Let's have a look at this one.
Let's see what we have.
Right. What sparked the partnership with the Parkinson's Trust? Was there a personal connection or shared mission that made it a perfect fit? So this is obviously our
I don't think this one's
our
not going to
charity.
be the longest answer. Of course there is. Our grandfather actually died of Parkinson's. Mother's father's died of Parkinson's when he was still fairly young. And yeah, that's why we support the Parkinson's Trust, because it's really close to our mother's heart, and it's really close to our heart. I don't ever remember meeting him. I was still very young when he died.
We were both young when he died.
So yeah, I think it's an important charity because it's the kind of condition that, with further research and further studies and development, you can help people to just live a better, longer life and be able to manage it, at least the symptoms for a longer period of time. And I think they've come with leaps and bounds in the last few decades for Parkinson's, but there's still a long way to go. Yeah, and we've had them on our signature for quite some time. We've obviously given them a bunch of funding. Obviously, we'll probably do more. If you remember, we had them at our 10-year anniversary. We did. So they came to our 10-year anniversary, and we did a raffle for them and all sorts of things. So they got some funding that way, because we'll just support them as much as we can. We support other charities, but they are definitely our main one. Yeah, Parkinson's and Alzheimer's Society is the two biggest ones I'd say that we directly support. Yeah. Short and sweet. I think I did too. Short and sweet. You can. Short and sweet. Okay, so wild card. Right. It's a wild card one. I would brace myself for this one. And I don't know if we'll agree, but we'll see. If Megacare was an animal, what would it be and why? Right, if Megacare was an animal. Right, I'm going to go with lion. Okay. And I'll explain why I said lion. So not we because will disagree. But we will disagree, but we always disagree and agree to disagree. But the reason I say lion, not only because it's my favourite animal, right? It's my favourite wild animal. Big cats, but specifically the lion. I don't mind jaguars, but lions. The jaguars got the biggest bite force. It's incredible. Anyway, lions have a special way. They're social animals, but they are the kings as well of the. They say the jungle, but tigers territory. It is actually the king of the desert, right? The desert king of Spain. So that they just sort that out. But the reason I say lions is because they are, and the reason why we will be like, I can say that, if we're an animal, is because we are like, we're a family. We're a family business. Me, yourself, and our mother, but also our brother. We're a family, but also the rest of the company. We are a family. We deliver family-like, we're a family-like business. And the lions are social animals. Okay, well. Okay, it's a very interesting question, but also, I mean, I don't want to get to the whole point about being like the predators, the main predators of the apex predators of the desert, because that doesn't look good for us, does it? So that's why I was way from. Okay, well, mine would be elephants, also, not because it's my favorite animal. The reason I'll say elephants, right, is because elephants are also huge social family creatures. Yeah, right? They are, yeah. And they have a keen understanding of the need to look after both their old and young. So when you see them in the wild, you will see the healthier of the groups surround the young and the elderly and walk with them to prevent the lions from preying on them.
And that's a good point, because to be fair, the lions, even in their social, capacity, if anyone is weak, has a limb, got attacks, they just get rid of them and press on towards eating the elephants up. But
yeah, they look after their weak, they look after their young, and they even stay with them and mourn with them when they die. So
yeah, they do.
In the
funeral,
the thought of that brings us to mega care. That's what we do. We look after the old, we look after the young, we care for them all the way up until they die, and we have a very huge palliative service. Mother is an advanced nurse practitioner, specialist in palliative care, won awards in palliative care. So yeah, I feel elephants suit us slightly more than predatory lions.
You feel happy about bringing that palliative care into it?
Bring it round full circle, you always have to be able to throw in some mega care.
But as you touched on palliative care, though, it is incredible, right? A couple of months ago, we won the palliative care, was it palliative care special, end of life
palliative
specialists, for home care association, right? That's huge. Winner across the nation. That's brilliant achievement, and that's testament to our mother being a palliative nurse specialist and having a keen interest in this, right? End of life care.
That's one of the things we've been doing for many, many years. We've been doing it ever since. Since 2014. The latter part of 2014 is when we started working with Northamptonshire CCG, and we've been working with them ever since, and caring for more and more people ever since.
We work with the is it hospice? We worked with hospice in Northamptonshire, don't we?
We've worked with hospice in Northamptonshire, General Cransley, getting them out, but that's when we was in spot. Now contracted, everything generally comes through the CCG.
Gold standard framework as well. We've just completed that portfolio.
We've just completed, submitted. I wanted to say now we can use this as a soundbite. We were successful. We got it, but
not yet.
This can be put into later on when we've actually got it. You don't know.
Yeah, but that's huge, because that's the standard of end of life and palliative care across the nation. And if we get that, that's great. Great just achievement, right? We can do more with that to support people that are, struggling and dying. So
yeah, I mean,
elephants. We'll go with that.
If this is posted to anywhere where there's comments, comment to us what animal we are. Yeah.
But yeah, I think I can concede that elephants is a better option than lions at this point. Yeah.
Lovely.
Okay. Right. Where are we then? Let's get one that's not a wild card. Wild card? No, I'm joking. Right. How do you make sure the care you deliver is not just good but great? I think we've answered this in partly, but you can.
Yeah. So for instance, we look at the minimum standards requirements for good, and that to us is our minimum standard. We will never stop there. We deliver great care because we spend time truly learning and understanding our service users and what they go through. We have lessons learned in every meeting that we hold, and we audit and look back at the work that we're doing consistently and always try to improve. Any form of negative review or comment or complaint is always not always a major issue, seen as a major issue, because we don't want to add to people's negative feelings that they're already feeling from being in a situation that they may be aging, ailing, dying. We want to be there to provide them joy, peace, relaxation and comfort, right? So I feel like if you focus on the service user themselves individually and try to improve their individual lives and their individual outcomes, and you do that for every single service user you have, even if it goes to hundreds, then the care you provide will be great, because it'll be great for each individual.
Yeah, but we've also got structures, haven't we? We've got all the different structures. We've got from carers, and they're overseen by key colleagues and then coordinators, etc. And it goes up to our management, and we spend a lot of time because it all does come from the frameworks of how we are structured that will enable the best care possible, because everyone, you're trained well enough and you understand enough things to ensure that you are picking up things to enhance people's lives. But we do things like regular peer group meetings, right, where we bring topics that are the key topics of the public bodies, like the NHS or the societal things that can come in, like the outcomes focus was discussed at great length, or how do you best personalise care, such self-directed care and support. These things are discussed at management level on a regular basis, but then it also goes up to our management general meetings that we have, right? And that's where we sit down and we discuss as managers, directors, PAs, the rest of the key departments, and we talk about what has happened, throughout the last few months, and best practice. We share best practice across the different branches, and we enable time for the discussions on how we can continuously improve. We give advice as directors as well about how we see things, and we give an opportunity for Meg, our mother, to give her own direction from a clinical perspective on how she thinks she thinks things are going, and give advice on how things can be even better. So we are constantly, through all the different mechanisms and structures, pushing to be better, to be better quality, and ensuring that all of our key managers and personnel are supported. So if they're supported, they will then manage better, and then from their better management, they will that kind of rolls out to the carers as well. They feel they'll feel more supported, our frontline carers, and and also is another thing would be to we provide a space for ideas and initiatives and suggestions from the front line. We don't just dispel of ideas or comments or whatever, but actually we enable them. We encourage them to make suggestions, to comment, to tell us,
improve.
absolutely, give us feedback, so then we can put things in place that are even better for better quality.
And I think it does help also that the majority of our back office support staff have been carers, all have worked in care, including ourselves.
Yeah, we've all done care.
That
I remember.
Just in general, then gives them the knowledge to better assist the carers on the front line to provide great care.
I don't know if you did this in your appraisal, but I told everybody when I was that I spoke to, right, the key managers underneath me and directors, that they all have to do and go out and do care. Of course, they'll get their DBS checked, and I'm sure they already have, and all their right compliance, but they will be going out to do care themselves for bits, right, for a good few hours. Why? Because it's so important that despite what you are doing, whether you're in the marketing team or whether you're in, you're an analyst or recruitment or whatever, that you have gone out and done care, provided care, and seen what the frontline carers do. So if, for example, you're in recruitment, you then will know firsthand, right, how it's like on the ground. You're not just thinking from a theoretical perspective what's been said to you, but you have the experience to be able to make the right decisions and changes that you need to make to ensure that it's more, it's better